chiropractor, Dr. Gregory Johnson, and today Jovetta is going to allow us to show you what we do on her 6th visit. Now, she had a whiplash type of an injury, so she is sustaining pain and torn muscles and tendons and ligaments in her neck, her mid-back, and all the way down into her lumbar spine and pelvis. And that's creating pinched nerves that are affecting some of her organ function as well. So we're going to show you what a typical office visit is like after we've already done the initial comprehensive examination, diagnostic studies, and then come up with the diagnosis and treatment plan. So let's go ahead and face the mirror for me there, Jovetta. And I'm going to have you close your eyes and flex your head forward and then backwards. And those of you that have been watching, you know that I do this every time. We evaluate their posture on the x-axis, the y-axis, and the z-axis. And you can see that her range of motion is kinked going both directions, forward and backwards. Did you feel that going forward and backwards too?
Yes.
Yeah. You can also tell that the subluxations or misalignments in her cervical spine are causing her head to be forward and rotated right to the left. And her upper thoracic spine follows suit there. Right shoulder is in front of the left one. Right pelvis is out in front as well. Plus the pelvis has translated to the left of center on the x-axis. Okay, Jovetta, let's come over here and lay down on your tummy for me. Now, I decompressed her last visit, so I don't need to do that today. We'll go ahead and do this one first. And we're going to check her leg length, as we always do, just to see if she has a functional short leg, and she does on the left, about a half an inch. Now, when I bring it up, you see them get even. Now, see her pelvis raised up in the air when I did that, too. That little tender right there, Jovetta?
Yes.
Yep. There you go. And you always want to have the patient scoot up in that hip piece just a little bit more. And totally relax when you do this. And I let the head down a little bit, too, so that it kind of opens those joints up and gives us a better adjustment. I'll be adjusting both sacroiliac joints in the X, Y, and Z axes here. Now, straight down on her sacrum from superior to inferior, which is the y-axis, and L5 straight posterior to anterior in the z-axis, all the way up to L1, L2, and then right here is her lower thoracics, mid-thoracics here, and I know you heard that one over there even. Excellent. And we're going to have to adjust those upper dorsals with this move. Now just relax this in my hand. Okay, now tighten this thing up, or just relax this. There we go, much better. See how tight those shoulders are today? Feel that, Jovetta?
Mm-hmm.
See, she's got trigger points that have developed in her trapezius muscles and levator scapular muscles, as well as rhomboid muscles up here. And they have tightened up, and I'm going to be putting some direct pressure in here. That's pretty sore right there, isn't it? Yeah. Can't do this really hard at first. She's still in the acute inflammatory phase of her injury, so we have to take things nice and calm. We do have her doing ice, crushed ice on the skin at home, 20 minutes to reduce the inflammation. But we always want to keep these things moving, because turn you on your back now, because movement is the key to rehabilitation.